Most people don't realize that their health insurance contains free preventive benefits that can help catch problems early, saving them hundreds and even thousands of dollars later. Well, today I'm going to walk you through 5 preventive services covered at no additional cost to you, go over what's actually included and what could still leave you with a bill. Hey, it's Shamy. I'm a healthcare finance consultant, and this channel is all about helping you understand how to save money on healthcare. So if that's something you're interested in, please subscribe down below. For these services to be covered for free, meaning no deductible, no copay, and no co-insurance, you have to have an ACA compliant plan, such as those on the marketplace and most private insurance plans from your job, and they have to be performed by an in-network physician or provider. And a quick reminder that I am not a medical doctor, nor is this video intended to be a substitute for advice from one. Let's get started. Item number 1 is colorectal cancer screening, and this is becoming increasingly important as more people are being diagnosed with colorectal cancer at an earlier age. Screening is recommended for people between the ages of 45 to 75, and screenings can include things like stool-based tests done at home, where you collect a stool sample at home or poop at home, and then send that sample to your doctor's office or lab for testing. Or you can opt for a test that looks inside your colon or rectum, such as a colonoscopy. But here's where things can get confusing. If you take one of those stool-based tests at home and your results come back as abnormal, your doctor will probably schedule you for a follow-up colonoscopy. And many insurance plans will consider this follow-up colonoscopy as diagnostic rather than preventive, which means you might have to pay an out-of-pocket cost associated with that. The same thing happens if you opt for a screening colonoscopy. Back in the day, if your doctor found and removed a polyp during a screening colonoscopy, some insurance companies considered that test to be diagnostic rather than preventive and used to charge out-of-pocket costs. But later, the government clarified that finding and removing polyps is a normal part of a screening colonoscopy, so there should be no charges associated with that. But just to be safe, if you're opting for a screening colonoscopy, call your insurance company and ask them whether there are any charges associated with it and if those charges change depending on what's found. Because the last thing you want to get is a surprise bill for something you thought was free, and asking these questions up front can help you get these preventive services while maximizing your benefits. Item number 2 is statin prevention medication. Statins are medicines that help lower your risk of heart attack or stroke by helping to lower the level of cholesterol in your blood and other fats. And according to the Office of Disease Prevention and Health Promotion, experts recommend that if you've never had a heart attack or stroke, you should take a statin if you're between the ages of 40 to 75, you have high cholesterol, diabetes, high blood pressure, or you smoke, and if you're at higher risk of heart attack or stroke per discussions with your doctor. According to the ACA, if you meet this criteria, statins are covered at no additional cost to you if they're prescribed as a generic brand. And that's where things can get a little sticky. You may end up paying a copay if your insurance company doesn't have generic statins in their formulary or the list of drugs that they covered, but has them on a higher drug tier, or if your doctor prescribes you a brand name statin. If you receive a bill for statins and you think you're eligible to receive them under your plan for free, then call your insurance company and ask them why they charge you for it, or consider asking your doctor to prescribe you a generic brand instead. That way, you can help prevent a major medical problem down the line for free. The next one is something everyone could use at some point in their life, whether you're an entrepreneur burnt out from doing it all, or you're nearing retirement and stressed out about entering this next phase in your life. And I'm talking about depression screenings. Now, I know the D word scares a lot of people and makes you think that if you're honest about the dark thoughts in your head, you'll automatically be sent straight to the psych ward. But that's not the purpose of these screenings, and that's not how they work. It's to get a sense of the severity of the depression you're experiencing, if any, and to determine if your symptoms warrant further assessment. It's not a definitive diagnosis of depression, and these screenings are meant to work alongside clinical judgment, not replace them. This screening is a standardized questionnaire designed to assess your mood, your daily functioning, and potential risk factors for depressive disorders. And your score on it determines the severity of your symptoms. They're usually administered by your primary care doctor, but can also be administered by a mental health professional as well. Preventive service number 4 are lung cancer screenings. And yes, I've included 2 cancer screenings on this list because cancer is the leading cause of death in America, second only to heart disease. And lung cancer in particular kills more Americans than any other type of cancer, so it's important to catch it early and treat it when your survival rate is higher and it's less expensive. The Office of Disease Prevention and Health Promotion recommends that you ask your doctor about this screening if you're between the ages of 50 and 80, you currently smoke or quit smoking in the last 15 years, and you have a 20-pack year history of smoking, meaning you either smoked 1 pack per day for 20 years, 2 packs per day for 10 years, etc. If you meet all 3 criteria, your doctor might recommend that you get an annual low-dose computed tomography, or LDCT for short, which is a scan that takes a picture of your lungs. If the screening test result is abnormal, you may need to have more tests done to find out whether or not you have cancer, at which point it'll be considered diagnostic rather than preventive and not covered for free. So you may be subject to a deductible, copay, or co-insurance depending on your plan. Now, enough of the cancer and on to something happier. Preventive service number 5 is related to bringing life into this world, and that's breastfeeding support and counseling. This support is both for pregnant women and new moms. So if you or your spouse are expecting, your health insurance company may provide services to make this process a little less overwhelming, which includes things like figuring out how to help the baby latch on properly, guidance around pumping, nipple pain, and other common breastfeeding challenges that can be overwhelming for first-time parents. Your plan may also cover breastfeeding equipment like electric breast pumps and supplies like those for storing breast milk. But while these services are covered by insurance, your plan can impose limitations for things like which providers are covered, how many visits are covered, and what type of breast pumps you qualify for, including whether or not the equipment can be rented or purchased. So, since the devil is in the details, it's always a good idea to speak with your health insurance company about your specific coverage and limitations before your baby arrives. But overall, this is one of those benefits that can help provide a lot of practical support during a major life transition, while also helping you avoid unnecessary out-of-pocket costs. Which of these preventive services did you not know was covered for free? Let me know down in the comments below. And in the meantime, if you want more ways to figure out how to stretch your healthcare dollars further, check out this video on surprisingly cool things you can spend your HSA dollars on. Thank you, and I'll see you in the next one.